This is Dr. John Wycoff. Welcome to Pathway to Wellness with Dr. John Wycoff. You're truly. We're going to explore exciting ways to get you on that road to health and wellness naturally, get you on that pathway to take charge of your health. We're going to talk about things that your doctor will never talk about. They may not know. They certainly don't want to explore with you because doctors really are taught to prescribe medications. They have a pill for every ill. At Wycoff Wellness, we practice integrative and functional medicine. If you're not familiar with those terms, check out my podcast on functional medicine and what separates the mindset that I have from the mindset of most conventionally trained doctors. So let's get on the road today with something that is really, really important: intestinal health. We know that there's a connection between the gut and the brain, the gut-brain connection. That's very, very important. And, you know, that old adage, you are what you eat, is very much true because what you eat affects your digestion. I'm going to try to break it down as simply as I can. The gastrointestinal tract runs from your lips to your anus. And it's a tube. It's actually a tube. It starts out with the mouth and the esophagus and the stomach, small intestine, large intestine, rectum, and anus. But really, it's about a 15-foot long tube. And you can think of it as a conveyor belt. And really what digestion is just how this conveyor belt moves along, just like an assembly line. At different points on the assembly line, different things are added and taken out. Same thing happens in your intestinal tract. Things are added in your mouth. It starts out with saliva and chewing. In the stomach with gastric acids, digestive enzymes. In the duodenum with pancreatic enzymes and bile from your liver. And then absorption through the rest of the intestinal tract and then into the colon, that last 5 feet or so, 5.5 feet, where fecal material is created and ultimately eliminated. So when food goes through this, it's a pretty boring process, but yet it causes so many issues. And oftentimes people have a lot of symptoms. They relate to their stomach and digestion. They have reflux. They have peptic digestive symptoms. They have constipation. They have diarrhea. They have bloating. They have abdominal pain. They have blood in their stool. They have mucus in their stool. All these things that you just say, well, something must be going on. You go to the doctor and he probably pushes on your belly a little bit, maybe runs a test, does an ultrasound, maybe sends you to the gastroenterologist. You have a colonoscopy and maybe an esophageal gastric duodenoscopy, a EGD, and doctors say, listen, it's fine. You don't have polyps, you don't have cancer. You must have irritable bowel syndrome, IBS. And that means they have no idea what's wrong. And they give you some medication, you know, some Prilosec or some other acid medication or something for intestinal cramping or fiber and push out the door, and that's it. And that's just not fair. So let's kind of break down some of the roles of the intestine. The intestine is, first, it's a protective barrier. The inner lining of the intestine, 1 cell thick, the mucosal lining, and it protects us from anything that is bad that we get into our gut, anything from our environment and our food, anything we swallow. It's a protective layer. But you have to work to keep it healthy. Things like antibiotics, things like chemicals in foods, they disrupt that intestinal lining. And it doesn't serve the protective effect that we want it to be. So we need to, one, get on a healthy diet. That's fresh fruit, fresh vegetables, the color of the rainbow. We need to cleanse and wash our food before we eat it. I recommend that for all produce that you take it home, mix in up on your sink some water, just tap water. Add some vinegar, maybe a half a cup to a cup of vinegar, a few tablespoons of baking soda, and then put your vegetables and fruit in that solution for just a couple minutes. Rinse it off, put them in the fridge or on the counter or whatever containers you typically use, and you'll be amazed what comes out of the fruit and vegetables. Berries are the worst. They'll be just ridden with toxins and pesticides. Even the food that claims to be organic will have various residue on them that is good to take off, let alone the dirt and everything else. So, take your vegetables and fruit and wash them. I really think it's imperative that you try to buy organic beef and chicken, wild-caught fish, free-range eggs, organic eggs, free-range chicken eggs. All of that reduces these chemical exposures. These chemicals damage that lining in the gut. So we need that protective barrier to be maintained, and also just a healthy diet, not a lot of sugar, not a lot of carbohydrates. If we can keep things in balance, we can avoid damaging the intestinal lining. And we're going to talk about some of the things you can do to reestablish and keep your lining healthy as we go along. But we are creatures of habits. We have a lot of exposure to chemicals in the environment. We can't eliminate all of them, and some of these really like puncture holes in that intestinal lining that we have. And just like we have ozone in the air causing problems with pollution and such, it's a parallel world in the gut. You punch a hole in that protective barrier of the gut, and you lead to food allergies, food sensitivities, and various diseases. And then we compound that with like acid blocking medication, things that are not only prescription, but now over the counter, proton pump inhibitors like PPIs, like Prilosec, Protonix. We got the H2 blockers like Tagamet and such. These are all can be obtained without a prescription now. We got Tums and antacids, and then we use things like aspirin and ibuprofen for pain that break down the lining of the stomach, the intestinal wall, and basically create holes just like ozone does in the atmosphere. What we describe that in functional medicine as leaky gut syndrome. Some doctors are familiar with that term, and I would encourage you to read more about leaky gut syndrome. But leaky gut syndrome is much like a cheesecloth with holes in it, or a coffee filter that has little slits in it. If you have a coffee filter that has slits in it, when the water goes through it, it's going to carry some of the coffee grounds into the coffee. You're not going to like that. That's what leaky gut is. You've got leaks in the gut lining where things get into the bloodstream. So you can do things like glutamine, pantothenic acid, it's B5, zinc, folic acid, or methylfolate, B9, B12, vitamin A, and other things to improve your gut health. The other thing is just to avoid unnecessary broad-spectrum antibiotics. That's one of the downsides, downstream side effects, is that antibiotics kill the microbiome, the healthy bacteria that you have in your gut to keep it healthy. So if you're going to be on antibiotics, come and see me, talk with me on what you can do to mitigate the side effects of the antibiotics. Sometimes you have to be on antibiotics. Don't get me wrong. I prescribe medications all day long for a myriad of health issues, and I prescribe antibiotics when they're appropriate. But I try to prescribe an antibiotic that is very specific for the problem, like strep throat. If you're not allergic to penicillin, plain old penicillin, amoxicillin is a great drug for strep throat. We have more potent antibiotics, but they're just not necessary. So the right antibiotic, and then doing the right things when you take antibiotics, probiotics, taking glutamine, trying to avoid yeast overgrowth with berberine, are all things that you can do to keep the lining of the gut healthy if you have to take probiotics. To achieve optimal intestinal health, you need to avoid excessive alcohol, avoid excessive refined carbohydrates, sugar, and fiber-poor foods. The fruits and vegetables have a lot of natural fiber, which is good for the gut lining. Avoiding antacids, eating a diet rich in whole, unprocessed, nutritious food and fiber, going to the store and preparing meals. This is something that we really lost track of in society. We've become a fast food society and eating out society, and it's really hard to eat out, and it's impossible fast food because you can't control how the food is prepared. Oftentimes food is prepared in seed oils, Safflower oil, sunflower oil, grapeseed oil. These are just poisons. And eggs are fried in them at restaurants. And so you've got to, so you can prepare your foods. You can have eggs, fry them in butter, fry them in lard. Lard, there's nothing wrong with lard, but margarine is a toxin. Olive oil, healthy, use in your food. We can drink plenty of fresh water, pure water. And if you're not sure about the quality of your water, get a water purifier. If nothing else, just get a Brita that you put in your refrigerator. You can put an inline filter on your faucet. You can get a system for your entire house. But filtering your water is important. Unfortunately, bottled water has its downside because it's in plastics. You know, this stuff here, and I'm drinking it today, the plastic is soft, it tends to leach out various chemicals into the water. So you again, have kind of defeated yourself there in terms of drinking healthy water. You can take a probiotic, but probiotics are hard to get that are quality. We partner with a company called Metagenics, who I think produces the highest quality nutraceuticals in the world, and our probiotics are tested at every phase of development. They're kept refrigerated when they're produced, and they're shipped to us in a refrigerated container. We put them in our refrigerator. You actually don't have to keep them refrigerated if you can keep the probiotic bottle from being exposed to direct sunlight and high heat. But you can ensure that by putting them in the refrigerator where it's dark, and it's going to be cool. You'll ensure the longevity. But the probiotics you buy at the store, if they're on the shelf, they haven't been cold. They've never been kept cold. And how do you know how they've been shipped to the store? If they were produced somewhere in a warm state, they're put on a truck, shipped to the retail outlet. They may have gone across, a section of the country where it was 100 degrees, probably 120 inside the truck. The probiotics are dead. You're getting lots of dead probiotics. So get with a company like Metagenics. You can get their products online at wycoffwellness.com. Just click on our store. There's a whole myriad of probiotic choices. We like the Ultraflora Balance is probably our mainstay for most patients, but there's Ultraflora Acute Care. There's an Ultraflora strain for weight management. There's Ultraflora for children. So many different probiotics that you can get depending on your specific needs to try to improve your gut lining. We want different strains of probiotics. We want the lactobacillus, especially the NCFM strain. If you look on the label, it should have an NCFM strain listed if it's a quality product. Bifidobacterium lactis, BI-07 strain, most effective. Again, you should see that, BI-07 strain. And those are going to be listed as the type of probiotic and the strain specific. You get the genus, the species, and the strain. A quality company will list all three of those. You can add some prebiotics. Those are fiber, your fermented fruits and fermented vegetables, sauerkraut, to help the probiotics maintain longevity inside the gut and keep that gut healthy. You can also add substances like vitamin D, omega-3 fish oil, and glutamine, an amino acid, to try to ensure that the gut lining is healthy. The gut lining is very sensitive, and when it's unhealthy, you lose that protective barrier. So bacteria, yeast, parasites, toxins can pass into the bloodstream. We also know that our enzymes produced to help digestion do not work as well if we don't have a healthy gut lining. So ultimately, if your gut's unhealthy, you're not healthy. We see a lot of issues with brain health, anxiety, depression, cognitive decline, memory issues, not sleeping well, ADD, ADHD, general anxiety disorder, bipolar disorder, that oftentimes have part of the root cause into the gut and what we eat and what we drink. So get away from processed foods, get on a healthy diet, organic meat, organic chicken, beef, wild-caught fish, organic vegetables and fruit are fine, but if you can't get organic fruit and vegetables, I understand. Wash them though. You have table vinegar, white table vinegar in your pantry. You have baking soda, just a little bit of baking soda, a little bit of vinegar. Let them soak just for a minute or two, and you're going to find that the quality of the vegetables and fruit are going to be much better. They're going to be much cleaner, and a lot of those toxins will be removed. So not everyone who has abdominal absorption problems have symptoms, but a lot of people do. And the symptoms, as we talked about earlier, can be severe or mild, but they include things like gastric reflux. You get that reflux in your chest, maybe it occurs at night, wakes you up, burning in your chest, can mimic heart disease. You may get indigestion. You may get some right upper quadrant fullness under the rib cage where the liver is. Those are signs that you don't have a functional gastrointestinal system and maybe need some support. At Wycoff Wellness, we have specialized testing to look at your digestion. We can do a number of tests. Probably the most common test that we do is something called a GI special effects. This is a digestive test where we have you get a stool sample, you collect it at home and submit it to one of our biomedical labs. We use Genova Diagnostics and Mosaic Diagnostics most often, and they will look to see if the stool has abnormal amounts of undigested food, if there are parasite eggs, parasite DNA, look at the different bacteria. Is there the right amount of good and bacteria? Is there no bad bacteria? Is there yeast? And if so, how much? And if so, how can you treat it? Maybe you do need to actually be on an antibiotic to get rid of a potentially toxic bacteria and improve your gut health and wellness. So we'll help you guide you down that path to improved gut health. And we have a great program with Metagenics called Ultra Inflamex. Ultra Inflamex is a powder which is so beneficial for people with irritable bowel syndrome, who have any type of chronic bowel condition, even things like Crohn's disease, ulcerative colitis, inflammatory bowel disease. Those are really severe end-stage diseases where there's gastrointestinal dysfunction. But the Ultra Inflamex program, we can guide you through. You can get Ultra Inflamex in different flavors on our website at wycoffwellness.com. It's easy to take. It actually tastes pretty good. It comes in different flavors that are easy to swallow, and I think you'd find it helpful. So oftentimes the pathway to wellness for chronic disease starts getting better when we address your gut health. We can address your gut health based on symptoms, or we can do testing. We mentioned the GI special effects. We also do a test called an organic acid test, an OAT test, OAT, organic acid. This is a urine test, but tells us a lot about digestion in terms of yeast and bacteria that may be in your system that are causing your digestive system problems. We can see markers related to those in your organic acids. So the organic acid is another important test that we do frequently on people with anxiety, depression, autism, ADD. If you're having these things, don't just gloss over your GI system. I know that this is going to be new information for you because your conventional doctor won't even mention it. You might go in with the complaint of insomnia or anxiety or panic attacks or something like this, and your doctor is going to put you on a medication for that. Probably wouldn't even ask you, are you having any digestive symptoms? You need to be proactive and bring it up and say, doctor, I'm having a lot of digestive issues. I'm having constipation. I'm having diarrhea. I'm having gas, bloating, reflux, indigestion. Could that be contributing to my neurological symptoms, my neuropsychiatric symptoms, my depressed mood, my bipolar symptoms, my anxieties? And if they do blow you off, they don't pay attention to it, either find someone like me who can help you with the right testing that you need to improve your digestive system, or can get you on that pathway to wellness with the right nutrients and supplements. We talked about some of them earlier. Certainly, Ultra Inflammax is a great supplement for inflammatory bowel disease, but also just things like glutamine. We have a colostrum extract called Transfer Factor, another great product for maintaining gut lining. Adequate amount of vitamin D3, omega-3 fish oil. These are basic mainstay things that can help improve your health and wellness naturally. And they get on a diet. Get on a plant-based diet with some meat that's organic, wild-caught fish, and maybe a good multivitamin like Phyto-Multi. We carry that. It's a good methylated B vitamin. Really gives you the all-around nutritional support that you need to help your gut be healthy and also help your cells detoxify and produce energy. So I know we have these segments broken up into like methylation and detoxification, intestinal health. They all are interrelated. So I'd encourage you to look at those other podcasts because they very much fit into this topic of intestinal health. Some of these issues are controlled by genetics. We can do genetic testing for you and determine how well you methylate and maybe emphasize certain B vitamins and let you see for a fact that there are reasons why you're sick. I think that's what's very disconcerting for most people is that they're just kind of blown off when they go to the doctor and they just are given a diagnosis, which is a syndrome. If you ever heard the term syndrome, I have irritable bowel syndrome, I have fibromyalgia syndrome. Well, what that means in medical speak is that we have no test to show what you have. We can just prove what you don't have. And if we exclude all the things that we think we know about, and you're left with symptoms, and you don't have cancer, you don't have obstruction, you don't have anything we can really come up with, then you have a syndrome. Same with fibromyalgia, chronic fatigue syndrome, irritable bowel syndrome. These are syndromes. They are not diagnoses. They are a constellation of symptoms with no explainable cause. So if you have a syndrome, you need to come see us at Wycoff Wellness. Get a functional medicine approach and evaluation, an integrative approach to health and wellness. So that's going to wrap up our section on intestinal health. Please don't feel free to reach out to us anytime at wycoffwellness.com, wycoffwellness.com. Please like our podcast, share our podcast with anyone that you see. Our podcast, Pathways to Wellness with Dr. John Wycoff, can be found on anywhere that you get your podcast, whether it's YouTube, Spotify, whatever service you use, you'll find us. And look me up, listen to me, get on that road to health and wellness naturally, improve your health and wellness, and start that pathway, that journey to better health. This is Dr. John Wycoff.